यस, तो CA-125 लेवल्स अगर बहुत ज्यादा होते हैं, सो व्हाट विल बी द लाइन ऑफ ट्रीटमेंट अकॉर्डिंग टू अदर पैथीज? Is it possible to reduce CA-125 levels? When CA-125 levels, your answer is absolutely correct. Student name I really don't know, but I appreciate your knowledge and definitely अगर यही जज्बा रखोगे, so one day you will be a very good Ayurveda physician. So basically, you know, CA-125 levels, if are around 200 or 200 plus, then it is very difficult, and generally they ask for the uterus removal. Okay, but we can, the patient age is just 41, 42, or nowadays around in 30s the patient come to our clinic, especially Ayurveda clinic, and their CA-125 levels and everything is on very higher side, and from gynac the suggestions are like that you need to remove your, you know, the uterus. So definitely at the age of 35, 40, is it like good thing to remove the uterus? No. So basically Basti treatment and even Uttar Basti treatment plays very important role when there is a, you know, like we can say fibroids, if there is a, like in this case adenomyosis, endometriosis. और ये केस में ऐसे था कि पेशेंट को एग्जामिनेशन टेबल पे ले लिया था, patient the abdomen is open, but when they are tried to remove the uterus, there is a, you know, adhesions at the bladder side, adhesion at the intestine side. So ऐसे condition में there is impossible, if there is like any sort of you know like cut is there, then there are chances ki matlab so many complications. So they just sutured the, you know, abdomen as it is, and the patient used to take 3 to 4 painkiller every day. We did, first of all we have started not with Basti, but we have started with Vidhagni Karma. Thereafter we have started with Basti Karma, and I have not did Uttar Basti because patient used to have very severe pain, and thereafter Yoga Basti Kram we did, and because of severe, you know, menstrual flow, patient used to have very low hemoglobin. For that also there are different medicine that we have started. Lodhra Churna plays very important role when I speak about these things. So pain तो हमने कर्म कर दिया या बाकी सारी चीजें, but Lodhra Churna internally even you can use, plus Lodhra Churna आप उसको, you know, like you can make it like a tablet with the you know, small quantity of water and all, and you can keep it as an Yoni Pichu. It gives excellent result. Now I'm going to come at the, you know, the part where you can see I'm with the Vidhagni Karma. I don't know how many of you are aware about it. So this Shalaka is Rajat Shalaka. So Rajat Shalaka, I'm using Swarna Shalaka as well. Swarna Shalaka इज, अगर आप हमारे यहाँ पे रसभेदी अध्याय है, सो इन रसभेदी अध्याय द स्वर्ण इज कॉल्ड इट एज अ मधुर skanda, plus it called as a vishanashak as well. So many a times, you know, the patient takes steroids and everything. So Suvarna Shalaka plays very important role, but no problem. You can use Swarna Shalaka, you can use Rajat Shalaka, you can use simple needle, you can use Panchadhatu Shalaka. So how it is that gradually I'm going to show. You can see I'm just hitting the needle. Yeah, so you can see I'm just heating the needle, और उसके बाद ये needle patient के स्पेशली इंटरवर्टिबल डिस्क पे हमको जाना है. Yes, you can see I'm again heating it out. I'm just again pressing it. इसके बाद you can take different oil पीछू. ये काफी बार ये पंचकर्मा में जो इन्वेंशन कुछ हम कर सकते हैं. सो दिस आई हैव स्टार्टेड एंड आई हैव पब्लिश दिस एज वेल. सो डेफिनेटली यू कैन सी देयर इज अ पीचू. सो आई हैव अप्लाइड दिस ऑन वन साइड, यू कैन सी ये पूरा पीछू मैंने यहाँ पे रखा है, क्योंकि हम वो हिट करते हैं तो वहां के मतलब वो पोर्स सारे ओपन हो जाते हैं, और उसके ऊपर हमें एलोवेरा या बाकी चीजें लगाने बोली है, बट उसकी जगह पे अगर हम डिफरेंट ऑयल लगाते हैं, धानवंतरम हो गया, शीरबला हो गया, तो ये लगा के यू कैन सी दिस। उसके बाद में ये मैंने टिश्यू पेपर लिया है, ये मैंने वापस उसके ऊपर रख दिया, एंड यू कैन पैक इट आउट। और उसके बाद 24 आवर्स आप ये रखिए, वो काफी अच्छे से एब्जॉर्ब हो जाता है। मतलब कटी बस्ती का भी ये काम करेगा, प्लस इट विल वर्क लाइक विद्याग्नि कर्म विथ सम लाइक कटी बस्ती, और वी कैन से कटी पीछू एंड ऑल। सो इट गिव्स excellent result. You can keep it like this medicated the cotton or medicated tissue paper, you can keep it in your clinic. You can see I have almost all oils, and it's medicated tissue or oil papers. So you can see this is how we can use it instantly. We just keep it, and thereafter आप उसको fold करके, you can see all the pics are there, and thereafter you just do it like this. So this is somewhat I am just trying to explain about Vidyagni Karma. And first we have started with today's Facebook live, कि जहाँ पे patient को same this way treatment, but when it comes to Parvasandhi, so in Parvasandhi definitely you can use needles, small needles, because Parvasandhi पे अगर आप ये इतनी बड़ी शलाखा and all use करोगे, so it will not be flexible, patient को काफी pain होगा. So just युक्ति जो हमारे पास डिफरेंट प्रमाण बताए गए हैं, सो वैसे वी नीड टू यूज. सी मीन्स दिस शलाखा इफ आई एम यूजिंग, सो इट विल नॉट, इसके ऊपर का देखना पड़ेगा. सो ये शलाखा, या सो ये इतनी शलाखा भी हम यूज नहीं कर सकते. बेटर यू जस्ट गो फॉर सिंपल नीडल. इवन लेट मी चेक इफ आई हैव एनी नीडल. I think so I will have, because I do many a times sitting this Vidyagni Karma here itself. So you just use any sort of shalaka, and accordingly, yes, please bring needle. So with that needle also you can do, especially Parvasandhi, because RA patient come with the Parvasandhi shul. So when the small joints are involved, so that time you should use the simple needle. You can see this sort of needle you can use. I think so I am quite visible. You can see this needle. यहाँ पे fortunately एक दिया भी है. So you can see, you just hit it like this, and उसके बाद जो Parvasandhi means small joints, so you can touch like this, and thereafter definitely instead of applying this aloe vera gel and everything, you can apply this pichu. It gives very excellent results. So I talked about, you can see मैंने पूरा डिटेल में ये सारी चीजें बताई है, because I want that every one of you should practice Ayurveda. एंड दिस ऑयल, और उसके बाद ये माइक्रोपोर है, ये टिश्यू पेपर्स है, और आप ये पूरा रेडी, बिकॉज इन हैवी ओपीडी इट इज वेरी डिफिकल्ट टू मेक ऑल दिस थिंग्स. और उसके बाद ये आप ऐसे कर सकते हो. इन एंकलाइजिंग स्पॉन्डिलाइटिस HLA-B27 positive, then in RA especially you can use mainly Gandharva Hastya instead of other things. This is plays very best role. और विश्वगर्भ, महाविश्वगर्भ ऑयल ऑल्सो यू कैन यूज. या फिर सिंपली यू कैन डू इफ देर इज सो मच ऑफ स्वेलिंग, बिकॉज दैट इज आमावस्था. सो ऑयलिंग करने के पहले, स्पेशली इन RA, you should always be aware that if there is a swelling, क्लेदर है, so you should not apply the oil. Then one more thing, that is the स्वेदन कर्म. स्वेदन कर्म कहाँ पे यूज कर सकते हैं प्लीज स्टूडेंट्स? या आई वांट आंसर, because we have not talked till time about Swedan Karma. Yeah, our time is almost over. It's 10 o'clock. Any student, where we can use Swedan Karma?
More prominently in Samavastha, like.
Yes. Any diseases? Yes, students. I am also like student like you, please.
यहाँ पे stop बताओ.
Yeah, restricted movements, correct. Very good.
step back.
Yes, correct. Only Svedan Karma. I'm just talking about only Svedan Karma. Yes.
कफज से होने वाले जो रोग हैं, कफज के विलीन करने के लिए, तो विलय करने के
Yes, yes, correct.
वगैरह जो है उसके लिए भी श्वेदन कर सकते हैं.
कहाँ पे कर सकते हैं?
हाँ,
Yes.
सर ताम्रपत्र में भी कर सकते हैं हम वृक्ष स्वेदन डायरेक्ट.
वृक्ष स्वेदन कहाँ पे कर सकते हैं?
हम बात चूर्ण पोटली सर.
Yes, correct. Very good.
बालू का स्वेद.
और मर्मस्थाना.
Okay. Yes, yes, please speak. जब तक आप बोलना नहीं सीखोगे आप अच्छे डॉक्टर नहीं बनोगे. And I'm so happy of Delhi students.
आत्यायिक श्वास की अवस्था में भी यूज करते हैं मैम. स्नेह युक्त तुदन पूरा प्रदेशी ऐसा.
Yes, very good. See, I'm so happy. Clap for yourself. You have answered in a very good way. It is completely unexpected, but seriously, you are studying very well. So, definitely, I'm sure that many of you will practice Shuddha Ayurveda, Shastri Ayurveda, evidence-based Ayurveda. So, I will give you one example. So, basically, if you will read Matra Shiti Adhyay, okay? So, Matra Shiti Adhyay, there are different sort of ajirna avastha. So Vishtabda jirna, Vidagda jirna, so all these things, Ama jirna, all these things are there. So many a times in, Vishtabda jirna or Ama jirna, there are symptoms like a cardiac arrest or some cardiac pathology, because there is a severe pain in epigastric region, there is a radiating pain and everything. If you will read it thoroughly from the Sanhitas, then you can correlate that it is almost related to some cardiac pathology. So if you are like able to ruled out clinically with some ECG or something like that, because many a times this condition recurs, Vishtabdha jirna or Ama jirna, this condition recurs, and the causative factors are like adhyashan, then vishamashan, these things are there. So definitely we can ask the patient for the complete that hetu parivarjan, but with that we can definitely do that brusham svedanam term is there. So we can do Svedan in such sort of condition, because many a times they give Pandy, then they give muscle relaxant and everything, because they have epigastric pain, they have chest pain, they have radiating pain towards the hand and everything. So this patient are a special bread butter for the other pathy doctor or GPs, because they are recurrently coming to their clinic. But definitely hetu parivarjan is most important, that what is the causative factor. So you just take deep history, thereafter you will find the causative factor, you just do nidan parivarjan, and thereafter you can actually ask the patient to have like Brusha Svedan. There if you will read the Sanhita word by word, then definitely you will find the line of treatment. And if you will practice that, because your the Ayurveda treatment should be based on basic principles of Ayurveda. So in that condition also, where there is a similar symptoms like a cardiac pathology, but everything is normal, then definitely Brusha Svedan में पेशेंट को तुरंत रिलीफ मिल जाता है एंड पेशेंट like if you do hetu parivarjan and everything, the patient will be completely away from all these things, because simple ajirna, we have even different sort of, as I mentioned earlier, amajirna, Vishtabdajirna, Vidagdajirna. In Vidagdajirna, Vaman is explained. So definitely I give Vaman to the patient as well. And it also gives instant result in all sort of discomfort, because there the patient come with so many, the problems. And as I mentioned this Vidhagni Karma, so this you can do in all sort of patient, starting from headache to TM joint pain to after COVID. There are so many condition like a vascular necrosis of hip joint. There also you can definitely, if pain is there, then definitely you can do this sort of Vidhagni Karma, because it is a big joint. Then this sort of Vidhagni Karma, thereafter with some oil pichu like this, and thereafter Jaloka Charan and all. It is all depend on which grade a vascular necrosis of hip joint is there. So in this sort of condition, definitely one can play very, very important role. Then if I need to talk more, then there are in acute condition, there are patient who comes with like different sort of injuries. Many a times the patient come with different sort of injury. So for injury, you definitely, in allopath they use different sort of Savlon, Dettol and all. हेलो
दवाई मैडम आपके लिए लेके आए हैं।
हेलो
एक्साइटमेंट में आया फिर मैं
yeah, so many a times they use different sort of antiseptic and all. There are different patient जिनमें heal नहीं होता है the wound and all, and they are into the very severe pain, because if there is a diabetic patient, they also come with some wound and all. There are varicose ulcer, they also come with so much of pain and all. So in this sort of condition also we can do अपने यहाँ पे लेखन कर्म बताया गया है. सो दैट लेखन कर्म शिरिद्रुवल्कादि चूर्ण, इट इज वन ऑफ द बेस्ट चूर्ण, शिरिद्रुवल्कादि चूर्ण. सो यू कैन यूज इट एंड you can definitely rub it at that site, and thereafter you can जो भी the dead skin and everything, you just remove it out. If necessary, you just apply the leeches and internal medication if you need to start, but definitely you can give results. You can varicose vein, because it is also a very painful condition. Many a times they do 3-layer dressing and everything. So in this sort of condition, this Shiridruvalkadi Churna plays very important role. So start using this medicine, learn about this medicine, and definitely you will able to give the results which is not possible with any other pathy. So you just need the knowledge of medicines. And always I will conclude with one important thing, that we have 3 sort of treatment, that is Satvavajay Chikitsa, Daivopashray Chikitsa and Yuktivopashray Chikitsa. So always keep in mind that we are not treating the machine, we are treating the human beings, we are treating the souls. So we prasanna indra atma. So ये सब कुछ इंद्रिय आत्मा सब कुछ हमारे यहाँ पे बताया गया है. So accordingly our treatment should be there. So prasanna indriya atma, that should be our goal. So accordingly we should practice. We should always start with Satvavajay, that is giving confidence to the patient about Ayurveda, because there are so many malpractices on this like big platform. I need to accept this, that there are so many malpractices in Ayurveda. So definitely giving confidence, giving awareness, and boosting their the moral, that is very important. So Satvavajay Chikitsa, Daivopashray Chikitsa. So definitely Veena madam is one of the best teacher to teach you about these things, and please learn. Once you are into the practice and all, then definitely पीछे मुड़ के देखना बहुत difficult होता है once you sit on the physician chair. So Daivopashray Chikitsa, and thereafter it comes the Yuktivopashray Chikitsa. Yuktivopashray Chikitsa, simple example we see where we can use Shalaka, where we can use, simple needle and everything. So apply all these things during your practice, and definitely there are so many treatment protocols with which you can definitely give relief to the patient in acute condition. With that, I would like to conclude. Any question? Most welcome.
अगर किसी के प्रश्न आए तो पूछ सकते हैं वन बाय वन.
Oh, ma'am.
Yes.
Myself, Suresh Dubey.
Yes, Suresh.
Ma'am, I duly agree with the point that we should treat our patient with the proper diagnosis on the basis of their prakriti and all. But what about the that time duration that a patient doesn't generally want to spend with an Ayurvedic doctor and to follow the treatment in general? We can say, I have also seen in my OPDs that patient doesn't want to follow the whole treatment with an Ayurvedic doctor. In comparison, they follow the modern medicine. So how can we motivate the patient towards it? Thank you so much, ma'am.
Yeah, a very good question. So basically, see what happens. The patients are like, for modern medicine, even small kid is knowing that for fever, crocin is the treatment. But what about the Ayurveda? So definitely you should speak to the patient that what is your condition, what sort of vitiated doshas are there, what will be the line of treatment. So when you will give, that is where the Sattva Vaidya Chikitsa, plays very important role. And if you will see that, Adya Rogi Bhishak Vasho. So Bhishak Vasho is only possible with us. If you will explain everything to the, patient, then definitely this is possible. You can definitely convince the patient that how you can actually, what is Ayurveda, what will be the line of treatment. Because when I do Panchakarma, patient are many a times used to for the spa treatment. They feel that wow, I will feel nice after the treatment and all. But when I give that Basti treatment, so that time I feel that like Matra Basti is okay, but when I give Niroha Basti, so that time patient is like, oh ma'am, I'm drained out and everything, is it okay if I will go with only Snehan and Svedan? So that time we should give the confidence that it is not like that. Your each and every cell should be get detoxed and everything. So this thing should be there, that we should give the confidence to the patient, then only it is possible.
Sure, ma'am.
Yeah.
One more thing, ma'am. The modern medicine what teaches us actually that not the prashavan of doshas, but avaranat of doshas, if we could talk in Ayurvedic terms. But the patients are acceptable for it. They accept this thing that okay, I cannot see my disease to be upcoming, so I'm okay with it. And you Ayurvedic people are not capable of it in that particular duration. So that's the thing which is different for me, and that's why they are attracted towards the modern medicine. So these things that the avarana of dosha, what I can see that we cannot see the dosha, you cannot see the disease or its effect for a while. To take your patient in confidence that yes, you are under the treatment. So would it be wrong ethically, or should we move towards it also, or we can seek this help of modern medicine or from Ayurvedic point of view?
Yes, a very good question again. So basically, see, many a times there are so many, myth about Ayurveda. Like, my topic is today is acute pain management in Ayurveda. So many a times, patients are unaware. That is their ajnanata. Okay, so whatever we are learning, we know about it. Like there are so many things. Like in Ayurveda, we already learn that is pratyaksham hi alpam or apratyaksham wo bahut zyada hai. So many a times we should counsel the patient. We should give the time. We should speak on social media. Why I have my page? It is only because it is not for, like already madam knows that I have my own established practice. I'm working on for so many projects and everything. But still, why I am talking? Because there should be awareness. We should teach on social platform rather than just scrolling some reels and everything. Being an Ayurveda physician, और आज आपका जो generation है उनके ही हाथ में है. You should speak about what is Ayurveda, and that days are after COVID only itself vanishes. कि मतलब the question about Ayurveda and all. Now everyone want Ayurveda. Being an Vaidya, we are somewhere unable to provide the scientific Ayurveda to the world. Let me give you example. From 10th and 12th of this month itself, I am going to teach USA students, and they have all medicine lists starting from Jata Mansi. Previously, I was really very confused at what I will teach. They know everything. And they have Amrutottaram Kashayam, they have Ghrutam, they have everything starting from Jata Mansi to all other medicines. So all medicines they are learning, and there is a Southern California University of Ayurveda. So world is demanding. So that era is completely gone. There are couple of still doctors or patients are there who are completely lacking the knowledge about Ayurveda. There are so many doctors, even one I can say he's a plastic surgeon. He wants some study for Ayurveda, that how we can, that when they give finasteride and all to the patient, and thereafter there is a problem for male baldness and everything. So what we can give Ayurveda from Ayurveda, instead of that. So there are so many things, and now everyone want that from Ayurveda, but unfortunately we are not able to give it. Today also I have one meeting, and there they invited me, but I am the lone person already for USA student. I just want to give lecture and everything. So it is very difficult for me to actually to take lecture, and because OPD is also there. If you will see this live, that time also it is like this only. So you can see that since there are so many things, only we are not able to reach to the people in a scientific way. So if we will start speaking कि नहीं यही हमारा आयुर्वेद है, हम इसी तरह ट्रीटमेंट करते हैं. If patient come, मैम 3 days में हमारा पंचकर्मा कर दो, मैडम हमारा 5 days में पंचकर्मा कर दो. I am very clear. There will be पंचकर्मा, like it will be ऋतु वाइज पंचकर्मा. इट विल नॉट बी कि छुट्टियां चल रही है, बच्चों की एग्जाम हो गई, या फिर मुझे हॉलीडेज है, या मुझे अच्छा नहीं लग रहा है, या फिर मुझे बहुत अच्छा लग रहा है, सो मेरा पंचकर्मा कर दो. सो आई एम लाइक नो, डेफिनेटली इफ समथिंग इज देयर देन डेफिनेटली आई नीड टू डू. इफ एक्यूट कंडीशन इज देयर देन डेफिनेटली आई नीड टू डू पंचकर्मा. अदरवाइज आई एम वेरी क्लियर, नो आई विल डू पंचकर्मा, बट Rutu wise, Prakriti wise, and if you need, there are so many patients. I just want to do Shirodhara. Why you want to do Shirodhara? If I will take history, the reason is completely different. So accordingly, if we'll counsel and if we'll stuck to our principle, whatever the basic principle we have, if we will stuck to that, then only we will able to reach with Ayurveda on global platform. आज भी इंटरनेशनल योगा डे है, बट इंटरनेशनल आयुर्वेद डे नहीं है, क्योंकि हम ही हमारे बेसिक प्रिंसिपल से स्टक नहीं है. जो है वो वी शुड बी अपफ्रंट कि ये आयुर्वेद है, ऐसे ही ट्रीटमेंट होगी. फॉर विद्याग्नि कर्म ऑल्सो देर आर सो मेनी क्वेरीज टू द पेशेंट. मैडम इट इज हर्टिंग, मैडम दिस इट इज लाइक दिस, मैडम ये मतलब चिटका लग जाता है, मैडम ये हो जाता है. यू टेक इंजेक्शन, you take salines and everything, you go for operative. So definitely there is one book, Power of Subconscious Mind. So in that it is mentioned everything, what is there in our Vedakalin. In previous, if you'll see anesthesia and all, so if you'll read that Power of Subconscious Mind, that book, so it is mentioned that many a times, if we train our subconscious mind, then definitely lot of pain we can absorb. So what our ancestors are used to do, the same line of treatment. Now there is lot of things people are talking about, Daiva Upashray Chikitsa and all. If we will talk, then it will become superstition. No, we should talk in a scientific way. There should not be. Why? In foreign countries also there are so many stones, like I am wearing amethyst. This is the amethyst, gifted to me by one friend from foreign country, and she has a lot of knowledge. We have Rudrakshas, we have so many things, like they are using black tourmaline and everything. There are so many practitioners about these things and all. in foreign countries, and they have like to protect themselves from mobile radiation, they are using like Tourmaline and other stuff. Then why can't we talk about what we have? Right? Like we are not that great. Daiva Upashray Chikitsa doesn't come under, like we have very limited knowledge, but whatever the knowledge we have, but it should be in a very shastriya way. That is the need of our, because many a times what we do, that it's okay, मतलब हम उनके हिसाब से चल लेंगे, हम उनके हिसाब से कर लेंगे. If I work with allopathy doctors, like here there is a Apollo, the hospital, I am very clear if I am giving this medicine, because many a times there is a patient or pregnant woman who are not able to tolerate iron. Then they ask what we can do. Sab deke ho gaya, but patient is not able to tolerate iron. There is nothing is possible like available with Ayurveda medicines nowadays. So that time is actually, that era is not there at all. We are completely into the different era of Ayurveda, and we should create it in a golden era of the Ayurveda. So definitely you should stuck, but for that you should stuck to whatever you have learned. You should not modify as per their influence. You should create your own influence. When I'm practicing here, no allopathy doctor can ask me कि ma'am like ऐसा नहीं ऐसा ही होगा. I'm like, this is Ayurveda. Your path is respected, but this is what Ayurveda, this is what I learned, and this is what in Samhita. If in future, if I will write one book that is also not Samhita, not Ayurveda, the Ayurveda is in Samhita only. Though it's Bruhatrayi, Lagutrayi, Nigantu, that is only Ayurveda. So we should stuck to what we have learned.
Any more questions?
Madam, I have one question.
Yes, please.
Madam, this is Ronak Mehta here from Mumbai.
Yes, Ronak.
I have one question kind of thing. Is there any line of treatment where in Ayurveda for something and treatment can be given to someone who is suffering from deep stress and anxiety?
Ronak
That is-
Mehta, yeah. So basically deep stress and anxiety, so definitely first of all you should go to root cause, why it is happening. So first of all, why it is happening with you, that will be the first thing. That means what is the causative factor, because in Ayurveda line of treatment start with hetu parivarjan. फर्स्ट ऑफ ऑल जो हेतु है उसको निकाल दीजिए, हेतु परिवर्जन, द फर्स्ट थिंग. द सेकेंड थिंग आई हैव एक्सप्लेन्ड अर्लियर, दैट विल बी द एक्यूट, बिकॉज आई हैव ट्रीटेड द पेशेंट ऑफ स्क्रीजोफेनिया एज वेल. स्क्रीजोफेनिया ट्रीट होना काफी डिफिकल्ट होता है, बट स्क्रीजोफेनिया भी हम ट्रीट कर सकते हैं. सो डेफिनेटली यू कैन स्टार्ट विद जटामांसी मेडिकेटेड वाटर. देन डेफिनेटली यू कैन स्टार्ट विद गोमूत्र हरित की. Then Gomutra Harit plays excellent role, and thereafter it comes some Karchuradi Tailam, the Talam treatment. It called as a Talam. So Karchuradi Tailam you can apply on your 4 fingers from your forehead and 4 fingers here, and this point is there. You can apply the Karchuradi Tailam, and there are other things where it is possible that you can take Shirodhara medicated, like Brahmi Tailam with Karchuradi Tailam, the Karchuradi Churna, and it is prepared, and that Shirodhara or every day you can apply this. But definitely Jatamansi medicated water, then Gomutra Harit ki, and with that you can actually start with this Karchuradi Churnam Talam. I have explained you well that where you can apply this.
Okay, surely, ma'am. Thank you so much, ma'am.
You're most welcome.
Ma'am,
Yeah.
with due respect, I want to include one thing on this anxiety. Actually, I have a paper on Marm Sikasa Shiromam and working on it. So with that gentleman, Ronak, I guess. So he can use that Marm therapy by itself using Prasupt Kamal pose on his head by trying to stimulate those Simant and Adipati Marm for 15 to 20 times, maybe 3 times a day before having meal. So I have done it practice in on 40 to 50 candidates, not patient actually. So got very much positive results. Actually, instant positive results. So this Ronak can apply it. Okay. Thank you, ma'am.
Sure. Thanks, Suresh. I'll do the same. Thank you.
Ronak, I just want to add one thing, that Marma practice should be done when you learn from someone. Okay, so Yash, I have started with the lecture with this thing only, that Marma should be, like first of all, you should know, because ये point का अगर ये point हो गया ना, so it is very troublesome. So definitely that's why I have not
Right,
included. Yeah, so it is very, because it is somewhere, Marmo point. It will, if you will press in a wrong way, or if it is, you will press it at the wrong place, then it will be troublesome for the patient. So randomly, it is very difficult. So better, Mr. Ronak, you just learn Marma, and thereafter from a very specialist. Definitely in Mumbai, if you are from Mumbai, then definitely you can learn, and if you learn it, then definitely you can practice it.
Surely, ma'am. Thank you so much.
Thank you.
Any other question? Only last question. If anyone.
Just one last question, madam. This is again Ronak Mehta here. Just want to ask, is there any line of treatment available in Ayurveda where the medical practice personal or professional, or is just like allopathy only does have that kind of treatment?
It's all depend, the counseling, medical professional, many a times I talk, during COVID also, there were so many things, and, afterward also, it called as a many a times brain fog. Okay, if it is brain fog, then definitely counseling, medicine, all these things plays very important role. But in that also, you should always go to anywhere, counselor, even MA psychology, that can also do counseling. So definitely, means it is all depend that why it is happening, and they will definitely understand that one person, and thereafter it is all, counseling is very different, and in Ayurveda it called as a Sattva-Vajra Chikitsa.
Thank you, Jyoti ma'am.
Thank you.
Thank you so much, ma'am.
Thank you.
The lecture was so awesome. It was like आपने हमें आयुर्वेदा से पूरा नरिश कर दिया है.
Thank you so much.
Thank you so much, मैम. आपने हमें समय दिया और इतने अच्छे से और बारीकी से एक एक चीज को एक्सप्लेन किया. जितना भी आपको समय मिला था, उसमें आपने बहुत अच्छे से, पूरा प्रयास के साथ आपने बहुत अच्छे से एक्सप्लेन किया. एंड मैम, थैंक यू सो मच.
Thank you so much. I would like to give a big thanks to Team Jignasa, and especially my teacher Veena madam. Madam, thank you so much. मतलब जब मैं स्टूडेंट थी, आप मुझे शालाक्य पढ़ाया करते थे, वो टाइम से आज दिन तक आपके आपका सपोर्ट, वो भले ही हर चीज में हो, मैं कोई प्रोजेक्ट पे काम कर रही हूँ उसमें हो, या फिर कोई और चीज में हो, मुझे हमेशा मिलते आया है. आपकी ब्लेसिंग्स आज भी मेरे साथ है, हमेशा रहती है. आई नीड नॉट to see the time or other thing. I can anytime call you. So that privilege I have always got from you, and I'm so blessed that I'm your student, madam, and I'm so proud that I'm the student of Dr. Veena Sharma.
यस मैम, इसी के साथ मैं दिल्ली ब्रांच प्रमुख डॉक्टर वीना हिमांशु शर्मा मैम, HOD एंड एसोसिएट प्रोफेसर शालाक्य तंत्र, MSM इंस्टीट्यूट ऑफ आयुर्वेदा, BPS महिला विश्वविद्यालय खानपुर कलान सोनीपत हरियाणा से वोट ऑफ थैंक्स के लिए मैं मैम का स्वागत करती हूँ.
सभी को नमस्कार. हम समय से बहुत आगे जा रहे हैं. सबसे पहले धन्यवाद आनंद भाई साहब का, जिन्होंने प्रवास में होते हुए भी हमें समय दिया, आशीर्वचन दिए और जिज्ञासा को आगे ले जाने के लिए हमें प्रोत्साहन किया. हमारे जो जिज्ञासा के नेशनल कन्वीनर, को कन्वीनर हमारे साथ जुड़े हुए हैं, उनका भी तहे दिल से धन्यवाद कि समय समय पे हमें हर चीज में वो हमें मदद करते हैं, उसके लिए उनका धन्यवाद. सभी स्टूडेंट और डॉक्टर्स जो हमारे साथ जुड़े हैं, उनका धन्यवाद. ज्योति मैडम, डॉक्टर ज्योति आनंद जोशी है ना, मेरी बहुत प्रिय शिष्य रही है. और जो भी मैंने इसे जब ये स्टूडेंट थी तभी बताया, और आज मुझे बहुत गर्व हो रहा है कि ये मेरी स्टूडेंट इतनी ऊंचाइयों पे पहुंच गई। तो थैंक यू मैडम, थैंक यू। आपने शॉर्ट नोटिस में आके और बहुत अच्छा प्रैक्टिकली, और आपकी इतनी अच्छी प्रैक्टिस है नेशनल और इंटरनेशनल लेवल पे कि मुझे बहुत अच्छा लगता है आपकी प्रैक्टिस और पेशेंट को ठीक होते हैं। सो थैंक यू। आप सभी लोग जुड़े हमारे साथ, तो इसके लिए आप सभी का धन्यवाद। जिज्ञासा दिल्ली प्रांत के नाते धन्यवाद।
थैंक यू सो मच।
नेक्स्ट 15 डेज के बाद, नेक्स्ट लेक्चर 15 डेज के बाद होगा, है ना। एक तो जलोका उच्चारण पे होगा, नाड़ी के ऊपर होगा, ये दो में से एक कोई लेक्चर होगा। अभी हमें डेट्स नहीं मिली है, मिलने के बाद कंफर्म करेंगे ग्रुप में। थैंक यू
थैंक यू सो मच। थैंक यू।
थैंक यू